main reason why I reached out to you guys is because knowing what I know, I've been pretty disappointed. And I feel like there's almost a negligence on the behalf of the government with the response to COVID-19. With I've heard statistics as much as 94% of people that have died have pre-existing conditions.
Mm.
And I haven't seen like that those pre-existing conditions don't seem to be addressed by the government. So I was just curious, what would your COVID-19 response be?
Yeah, that's a great question. So, uh, when a crisis hits, and then we always need to fall back on our immune system and on the health that we've been taking care of or that we've been neglecting, right? So, in many cases, when people get COVID-19, they may develop complications and be like beyond, like at a point of beyond return, um, due to their pre-existing conditions and due to the fact that they haven't been really taking care of their health. So this is true of cardiovascular disease and diabetes. We, for example, know that people with diabetes who have poor glycemic control are much more likely to develop complications from COVID-19 compared with people with diabetes who have excellent glycemic control. So it really comes back to taking care of our health the best we can so that we reduce the risk of developing any complications and boosting our immune system. And that's just in general. That's not only, that's not only specific to COVID-19. It also helps us fight all the common colds, the flus. It also helps us in the prevention and treatment all the chronic diseases like cardiovascular disease and obesity and diabetes and cancer. So it's a win-win on many fronts. And there's really quite a few things we can do. So let's see what we can do for our immune system by exercising and using hydrotherapy. Regular exercise has been shown to reduce the risk of respiratory tract infections by 40 to 50%. And that's only moderate exercise. That's only walking 30 minutes a day, only 3 or 4 times a week, which is good not only for your immune system, but also for your heart. But it's important to see how how powerful exercise can be for reducing the risk of respiratory tract infections as well. Exercise reprograms our white blood cells so that they're more effective in fighting different diseases, including infections and cancer. It also helps mobilize the white blood cells and help them in their differentiation. And they did a few studies with flu vaccines and how effective the vaccination was in terms of exercising. So depending on how people were exercising, that also determined the effectivity of the vaccine. So people who were exercising 3 times a week for 25 to 30 minutes a day for 10 months, they had an increase in antibody titers to the influenza virus compared to those who were not exercising. Another study randomized more than 60 healthy men at the age of 65 to 85. A third of them were exercising moderately 2 to 3 times a week. A third of them were exercising intensely, more than at least 5 times a week. And the last group was not exercising at all. And again, they got their flu vaccine, and the researchers were looking at the antibodies at 6 weeks and also 6 months. And we see that these are the titers against different strains of the influenza virus. People who were not exercising at all have substantially lower titers of antibodies compared to men who were exercising either moderately or intensely. And the ones who were exercising more intensely, at least 5 times a week, were even better off than those exercising moderately. But the biggest difference was between those who were not exercising at all and who were doing some sort of exercise. The next available prevention and treatment is water, both internally and also externally. We know that dehydration decreases the saliva antimicrobial proteins important for our immunity. So that means if you are dehydrated, your immune system is not working optimally in order to fight viral and bacterial infections. So you want to stay hydrated and drink enough water. But also water applied externally helps our immune system. Cold showers have been shown to reduce sickness absences by 29%. Also, sauna bathing reduces the risk of catching common cold by 30%. And it may seem that these are two contrasts. Cold showers and sauna is applying heat externally, but both work. And in Finnish sauna, you combine both. A traditional Finnish sauna, you go to the sauna and apply heat, and then you get into an ice cold water. And this paper was looking at the risk of developing pneumonia in middle-aged men. And the more frequently these men were using sauna, the less likely they were to develop pneumonia. So those who were using, everyone in Finland pretty much uses sauna at least once a week. But there's some differences. Some people use it 2 to 3 times a week, and some people at least 4 times a week. So if they were using sauna at least 4 times a week, their risk of developing pneumonia was cut in half compared to those using sauna 1 time a week. Now, this also corresponds to the numbers of COVID-19 in Finland compared to other Nordic countries. While in Sweden, they had 88 deaths per million, and Denmark and Norway still are much higher than Finland with 9 deaths per million. So maybe using sauna might be one of the factors that has contributed to decreased mortality due to COVID-19 in Finland. One potential compound in our diet, or one food that may be helpful in fighting viruses, is garlic. I need to say there's no specific study on garlic and COVID-19. These are just studies on garlic and other viral infections. But we know that garlic enhances the immune system against viruses and also against bacteria. Allene, that's one of the compounds in garlic, improves the function of monocytes, the white blood cells. There was a randomized clinical trial with 146 participants, where the researchers were giving 1/2 of the study participants a garlic supplement, 180 milligrams of allicin or placebo for 12 weeks. And those who were using garlic were much less likely, 3 times less likely to get common cold, and also their sick days were reduced 3 times. So garlic seems to be one of the foods that definitely has some great benefits. Now, another factor that plays a role is how much, when, and what you eat. So, what you eat, what is one part, but also the timing and frequency of your meals is another factor. And one thing that all we can do, then we all can do for improving our immune function is eating breakfast and eating a healthy breakfast. To give you a background, this is a white blood cell devouring a coronavirus. And this process is called phagocytosis, where the white blood cell encapsulates the whole virus and basically ingests it. Here it's in graphics. First the cell will just encapsulate the virus and then just like eat it and destroy it. And the number of viral particles or bacteria that a white blood cell is able to consume in a certain amount of time is called phagocytic index. And there's an interesting study that has been done in 10 healthy volunteers and 8 people with impaired glucose tolerance. They gave them 100 grams of carbohydrate, that's about 3 ounces of carbohydrate, from different sources, either sugar or honey, or through juice, or potato starch. And the findings were pretty fascinating. They were measuring the phagocytic index, and they found out that after all simple sugars, the phagocytic index, the ability of the white blood cells to devour bacteria and viruses, was decreased by 40% compared with the potatoes. So that tells us that if we eat some simple sugars, this may significantly impair our immune function for a few hours. We can see that this is 2 hours, 3 hours, 4, and even 5 hours after eating this meal, the immune function was down. Now, the impact of breakfast on total blood sugar depends on what we eat for breakfast. When we have a low glycemic breakfast, like a multi-grain bread, for example, compared with white bread, then our glucose control, our blood sugar control will be much more stable. And that means that also our immune function, the phagocytic index of our immune system will be higher, will be better. That means I like to encourage you to stick to the whole grains when eating breakfast, your oats and quinoa and chia seeds and granola and not sweets. Now, this is a phagocytic index in response to plasma glucose. And we can see that 3 hours after a meal, when plasma glucose drops lower, then phagocytic index gets higher again. So it's really about keeping your blood sugar under control. Now, fasting has been shown to improve the phagocytic index by 50%. So if you want to boost your immune system, eat a healthy breakfast, but also introduce some intermittent fasting, ideally on an everyday basis. Many people eat snacks in an attempt to keep their blood sugar under control. But what happens when we eat snacks? If we eat snacks, then our blood sugar fluctuates much more compared with eating bigger meals and having some intermittent fasting in the meantime. And so why eat breakfast? Another reason why to eat breakfast is that insulin secretion is the most efficient in the morning. And this is especially important for people with impaired glucose tolerance who need to make sure that their blood sugar stays under control. Eating breakfast has been shown particularly important for people with type 2 diabetes. Eating breakfast itself can reduce the blood sugar levels over the whole day by 20%, while skipping breakfast will increase the postprandial glucose by 37% after the subsequent lunch and by 27% after dinner. Breakfast has been also shown to be beneficial for weight control. The timing of the largest meal is important. Having breakfast, the largest meal of the day, will improve your chances of weight management. And if you're not hungry for breakfast, then my next question is, well, what did you have for dinner? You know, maybe everything was delicious, but maybe it was just too much food. So if you reduce the amount of what you're eating for dinner, then you can feel hungry in the morning. Now, one of the foods that may be super beneficial for a healthy breakfast is millet. They did a study in 70 people with prediabetes that lasted 12 weeks, and they were giving them only 50 grams of millet per day. That's not even 2 ounces. That would be like 2 packets of oatmeal, right? But in this case, it was millet, not oatmeal, not oats. And they found out that their fasting blood sugar was reduced substantially. Also, their postprandial blood sugar was reduced, and their insulin resistance was reduced after 12 weeks. And I'd like to share a delicious recipe with you. These are my favorite super millet waffles, where you take one cup of uncooked millet, 1 cup of rolled oats, 4 cups of water, and just a teaspoon of salt and a teaspoon of vanilla and a half a cup of lemon zest. And you just blend everything in the blender and make waffles in the waffle maker. And they're super delicious and super healthy. Another recipe with millet might be a millet loaf, where you cook the millet and you chop some onions and carrots and celery root and add some flaxseed and garlic cloves and thyme and rosemary, and you just bake everything, and it's really good. Also, some herbs may be beneficial. Mint is one of them. Mint has been shown to be beneficial for the airwaves and also for the gastrointestinal tract. When we look at the amount of antioxidants, berries have been suggested as like one of the gold standards for foods, and they have 10 millimoles per 100 grams or per 3 ounces of fruit, which is like, these are antioxidant packed foods. But when we look at mint, it has more than 10 times as many antioxidants per the amount. Of course, you will not eat as much of mint, but when you eat only a small amount of mint, that may really boost the amount of antioxidants that you will be consuming. So next time you eat your breakfast, include your berries, but also include a little bit of mint that will boost the amount of antioxidants that you will consume. And what are the benefits of mint on airwaves? They did a few studies with inhaling menthol that has been shown to reduce cough by 40 to 50%. 50% 3 hours after the cough challenge by citric acid, by inhaling the citric acid. And the effects really persisted for 5 hours after inhaling menthol. Now, what happens if you ingest eucalyptol, or an extract from mint? In this study, they took people with asthma and also healthy volunteers, and they were giving them eucalyptol in capsules, 3 times 200 milligrams per day for 3 days. And they were able to see anti-inflammatory effects. Some inflammatory markers were reduced by 40% in asthmatics and by 58% in healthy volunteers. They also did a double-blind placebo-controlled trial in 32 people with severe steroid-dependent asthma. And again, they were giving them eucalyptol in capsules versus placebo for 12 weeks. And they saw reductions in the dose of steroids they were using for their asthma by 36% with eucalyptol versus a 7% decrease in the placebo group. Let me just touch on what we can do with our sleep. Sleep has not been mentioned much, but it's really important for our immune system. They were doing a study on people who were getting their flu vaccine. These were 25 healthy young men, and some of them were sleep deprived. They had only 4 hours of sleep at night versus normal sleep. And those who were sleep deprived, their antibody titers were less than half compared to men who got their normal sleep. Another study was looking at 153 healthy men and women, 21 to 55 years old, and they were looking at sleep duration and efficiency, and they introduced the rhinovirus into their nose through drops. They were looking at the risk of developing the common cold. And sleep duration of less than 7 hours increased the likelihood of developing common cold 3 times, compared with having at least 8 hours of sleep per night. And also low sleep efficiency increased the likelihood of developing common cold more than 5 times. And this brings us to the importance of diet again. Fruits and vegetables have been shown to be important for producing enough antibodies in response to a flu vaccine. This was a randomized clinical trial in 83 healthy volunteers, aged 65 to 85 years. And they compared low fruit and vegetable intake, 2 portions or less per day, with high fruit and vegetable intake, at least 5 portions per day. And for 16 weeks, they gave them pneumovax vaccine, and also they got their tetanus shot. And the vaccine was much more effective in the group eating more fruits and vegetables. Now, why is it? One of the explanations might be nitric oxide, which is the signaling molecule, and it's been shown to have inhibitory effect on some virus infections, including COVID. And which foods increase our nitric oxide? It's mainly the green leafy vegetables and beets.
Doesn't nitric oxide help with endothelial function as well?
One of the functions is that it improves the immune function, but another one is you get more blood supply, everywhere, into your heart, but into every organ. And let me just finish with vitamin D. And it's important because it prevents acute respiratory tract infections. A meta-analysis of 25 randomized clinical trials has shown that vitamin D can reduce the risk of respiratory tract infections by 12%. And it's winter right now, and it's been recommended that we supplement vitamin D. And with COVID-19 in mind, it's really a good idea